Welcome back to Clinicanics. It is funny how some Nigerians and by extension some Africans call certain medical conditions spiritual attacks. They believe that such conditions are arrows shot at them by their enemies called village people. One of such conditions is shingles. Shingles is generally believed to be a spiritual attack because of the way it appears. It appears with a very scary rash and severe pain. So people often think this cannot be ordinary, but no, it is not true. Shingles is a viral infection. It is purely a medical condition. It is caused by the varicella zoster virus, the same virus that causes chickenpox. And it does not occur in anyone who has not had chickenpox. So for you to have shingles, you must have had chickenpox earlier in life. Many people who had this condition cannot even remember that they had chickenpox, either because it happened when they were children or it happened and it was mild, so they quickly forgot that they had chickenpox. But usually after chickenpox, the virus becomes dormant in the nerve roots of a person, and they can become reactivated once the person's immunity is compromised. What compromises a person's immunity? It may be treatment with chemotherapy, for example, or the person may have diabetes, HIV, or any other condition that is debilitating that can make their immunity to drop. And sometimes they don't have any of these conditions, but they just have been under enormous stress, and that can impair their immunity to the extent that they can now get a reactivation of that virus. So what are the symptoms? The symptoms include severe pain. Yes, it is a painful condition. Even before you see the rash at all, the person will be feeling intense pain or sometimes paresthesia, funny sensations in that part of the body that is affected. After that, you then see a rash develop. It is typical having blisters on a red background. Shortly after, the vesicles or the blisters are filled with pus. At that point, it is becoming so sore and ugly and painful. When the rash heals, you now have severe pain following the healing of the rash, and it can leave a bad and ugly scar. It is called post-herpetic neuralgia. That is the pain felt after the rash has healed. The person may feel feverish or may have other systemic symptoms like loss of appetite, headache, vomiting, nausea. But it is because it is attacking a nerve. That is why the pain is that much. The rash pattern is typical of the supply of the nerve. Where the nerve supplies, that is where the rash appears. And that is why you usually see it on just a strip of the skin. But it can affect any part of the body. It can affect the face. And when it affects that area of the eye, it is called ophthalmic shingles. Ophthalmic shingles is serious because it can affect the eyes and can result in blindness if it is not properly managed. So there are other myths that surround shingles in Africa. One of it is that people say it must not cross the midline. That's the rash. That if it crosses the midline, that person will die. But typically, it doesn't cross the midline because the nerve that is affected usually supplies one side of the body, unless both sides of, the nerve supplying both sides are affected. At that point, you can have the rash on both sides of the body. And even if they meet in the midline, that person is not going to die. That is a myth. It is not true. Others say that it is only elderly people that can be affected. Anybody can be affected by shingles, although age increases the risk of developing shingles. It is treated with antiviral medications, oral and topical. There are creams that can be applied. But on your own, to manage the painful condition, you will also need painkillers, which you can buy over the counter. But for the treatment of the condition itself, please see a medical professional. You may also apply ice packs because of the pain or arising from it. People say that you should not use the medical treatment method. You should use spiritual. No, there's no harm in praying, but please make sure to see a medical professional for prompt treatment so that you don't get complications like very ugly scars or blindness in case it affects the eyes. It is vaccine preventable. Vaccine is recommended for older adults, 50 years and older, not for younger people. There are 2 doses of the vaccine that are given within 6 months. So you may want to avail yourself of this vaccine. So the next time you see somebody with shingles, please understand that it is a medical condition. They have not been shot an arrow at. And let everybody see this so that together we can be on the same page and we can save lives. I'll see you again next week, God willing, with yet another topic. Until then, always remember good health is great wealth. Until then, bye.